Sion. I was wondering what you intend, if there's any way to fix the healthcare crisis that we're going through right now.
Let me speak very specifically about my plan. I have proposed a plan that says if you've got health insurance, then I will work with your employers to lower your premiums by $2,500 per family per year. And we're going to try to do that by setting up what's called a catastrophic reinsurance program. You know, a lot of the spike in premiums happens because one person in the company gets sick and they get leukemia. It's $1 million to treat them, and that drives everybody's prices up, everybody's premiums up. So we're going to try to work with employers to smooth that out. That's if you have health insurance, because your problem is cost. If you don't have health insurance, then we are going to set up a plan that is similar to the plan that I have as a member of Congress. Everybody will be eligible. Nobody will be excluded for pre-existing conditions, because I know what that's like. My mother died of cancer when she was 53 years old, and that was tough enough. But in the last months of her life, she was having to read insurance forms because she had just got a new job, and the insurance company was saying, well, maybe there's a pre-existing condition. Maybe we don't have to reimburse you. There will be none of that. You will be able to access it regardless of pre-existing conditions. If you can't afford it, we will subsidize you. So there will be nobody in America who wants health insurance who can't get it through my plan. But there's one other element to it that's important, and that is we've got to drive down costs for the system as a whole. So we are going to emphasize prevention so that we've got a health care system instead of a disease care system. Right now, we've got kids going to emergency rooms for treatable illnesses like asthma because they don't get primary care. Which means, by the way, we've got to encourage young people who are going into medicine to be primary care physicians and give them incentives to do that. We should be focusing on wellness. And if we reduced obesity to the levels that existed in 1980, we would save $1 trillion in the Medicare system. But the problem is right now, dietitians often aren't reimbursed in the system. So what we're going to do is create a prevention system. We estimate we can save $100 to $150 billion per year, and that's what we'll use to subsidize people who don't have care to make sure they've got coverage. Now, one last point I want to make on this, though. Hillary Clinton's got a pretty good health care plan. It's in many ways similar to mine. The question you have to ask yourself is not just who's got a good plan, but how are they going to bring it about? Because there's a reason why every 4 years presidential candidates come before you and say, I'm going to fix health care, and nothing ever happens. Through Democratic and Republican administrations, the drug and the insurance lobbies have spent $1 billion in the last decade preventing reform from happening. $1 billion on lobbying, campaign contributions, PR. So if we're going to fight against that, we've got to change how business is done in Washington. It's not enough just to elect a Democrat. We've got to change how business is done. And I want to give you an example. I admire the fact that Senator Clinton and President Clinton tried to reform health care in 1993. But they did it in the wrong way, because they went behind closed doors. They were very secretive about it. They didn't even invite Democratic members of Congress into the negotiations. Meanwhile, the insurance and the drug companies were lobbying Congress. They were running TV ads to the American people, convincing them that this was going to be socialized medicine. And by the time that the Clinton plan was actually released, it was already dead in the water. I'm going to do it differently. We're going to have a big table, and everybody's going to be invited to the table. We're going to have nurses and doctors and hospital administrators and patient advocates, employers, labor. We will have insurance and drug companies at the table. They just won't be able to buy every chair. And I will sit at the table also. I'll have the biggest chair because I'll be president. And I'll put my plan forward. And everybody will have input. And if people have better ideas, Even if they're Republican, come on with it. But here's the difference. This will all be done on C-SPAN. We will do this publicly so that the American people are part of the conversation. So that the American people are part of the conversation, and here's what that means. Let's say that a congressman who's carrying water for the drug companies objects to my plan that we're going to negotiate for the cheapest available price on drugs so that senior citizens and others who need prescription drugs aren't paying as much. And the congressman says, oh, you can't do that because these drug companies need all these profits to invest in research and development. That's usually the argument that they make. Well, I'll call in my healthcare expert, and we'll do this on TV, and I'll say, well, let me ask you, is that true? And the healthcare expert will say, the drug companies need some profits, but the truth is a lot of what they call research and development is actually marketing costs. So those TV ads you see on TV, right, where they're running through fields, people are looking all happy, you don't know what the drug is for. Except for that one drug, you know what that's for. See, he's all laughing, look at him. The point is that by enlisting the American people, by explaining to them and showing them what's going on during the course of a debate, you reduce the influence of special interests. You reduce the influence of lobbies because you're the countercheck. You are the countercheck on their influence because you can hold Congress accountable. You can hold me accountable. That's the kind of government that I want to help restore when I'm President of the United States of America.